I'm going to be presenting some work from a slightly different perspective on breast cancer. And Carl specifically asked me to talk a little bit about hormone replacement therapy in breast cancer, and then to discuss phytoestrogens in terms of the work we are looking at. As you know, during menopause, ovarian, estradiol, and progesterone production ceases. The withdrawal of estrogen then results in menopausal symptoms, and some of us may recognize that. Hot flashes, urogenital and breast atrophy, and also a decrease in bone density. Now, these menopausal symptoms have traditionally and most effectively been treated by hormone replacement therapy. As you know, hormone replacement therapy consists basically of two hormones, an estrogen and a progestogen or progestin. Basically, if you have an intact uterus, you need to receive both these hormones to protect your uterus from proliferation, endometrial proliferation. If, however, you've had a hysterectomy, estrogen alone would be given. And these hormones can be given in different ways, either orally or non-orally, transdermally or subcutaneously. They may also be of natural or synthetic origin. The estrogens are in many cases natural, but natural sources of progestins are less easy to come by, so most of the preparations have synthetic progestins either derived from C19 testosterone or 17-hydroxyprogesterone or 19-norprogesterone. Now, despite the fact that these preparations have been used since the 1930s, when they were originally used to treat the vasomotor symptoms of menopause. At that stage, estrogen alone was given, and it was only when there was a 5-fold increase in endometrial cancer that there was a realization that if an intact uterus was present, progesterone needed to be given together with the estrogen. In the 70s, the traditional use was that women would get it specifically if they came and complained of bad menopausal symptoms, and they would get it for 1 to 2 years. But at that stage, advocates of HRT, despite the fact that some side effects were trickling through, felt that long-term use of HRT would give palliative or protective care to women in terms of specifically two areas. The one is heart disease and the other one is osteoporosis. There was also a feeling that it would improve the quality of life of women, and as one advertiser said, keep her forever feminine, which maybe is a desire we should all have, I don't know. What this resulted in is that we saw an increase in the time of the regimens of HRT. So it became much more common for women to receive HRT for 5 to 10 years and even for lifetimes. Also women at later stages in life being put onto, in their 70s, being put onto HRT. And there was a skyrocketing of HRT prescriptions then in the 80s and 90s. However, recent large clinical, I'm sure most of you have read or heard about them, both clinical and observational trials have actually modified our perceptions of the risk-benefit. We're not quite so sure that remaining feminine forever is such a good idea. Now, a lot has been written on these studies, and there have been different studies. I decided for this talk to concentrate only on the breast cancer and to concentrate only on two big studies. The one is the Women's Health Initiative study, which was a large, randomized, placebo-controlled clinical trial done in the USA. I'll describe that in a little bit of detail. And then the other one is the Million Women study done in the UK, which was an observational study. So the studies compare in terms of what was done. They also compare in terms of the geographical regions and the types of medical systems operating at those times. So the WH study, just to summarize, basically showed there was an increase of breast cancer if the estrogen plus progestin was used. Now, this study had two arms. If you had had a hysterectomy, so there was no uterus, you would receive either conjugated equine estrogens, which is the estrogen, or a placebo, and you didn't know what you got. If you had not had a hysterectomy, you would receive either the estrogen, the conjugated equine estrogens, plus the progestogen, which in this case was medroxyprogesterone acetate, MPA, or you would get a placebo. Now the results taken from their first paper here, you can see that over time they monitored these people for 5.2 years. The study was actually stopped sooner than they'd planned because the hazard risk factor or ratio exceeded what had been planned. And for breast cancer, specifically invasive breast cancer, it was 1.26. I think it's sometimes difficult to understand these statistics, so this may be an easier way to interpret it, that basically the paper concludes that in terms of invasive breast cancer, there was a 6% higher rate of breast cancer. The other arm, the estrogen-only arm, which was followed up until 6.8 years, where the study was also stopped, not because of the breast cancer, but because of other side effects, actually interestingly showed a hazard ratio that seemed to suggest that it was protecting against breast cancer. And for many people, that was a very interesting statistic. However, I should caution that there have been follow-up studies, both of the group studied in the WHI, but also other studies. And this has shown that the situation may not be quite that simple. If you look at the very first, the two columns with the body mass index of less than 25, this is a group referring to leaner women. The second two columns are body mass index greater than 25, obese women. And you will then see that over time, the relative risk, which is now a new way of estimating risk, increases. So that if you've never taken HRT, your risk is 1. As you take it for longer and longer, your risk increases. So that if you're a lean woman, your risk will be 1.77, your relative risk, if you've taken it for 20 years or more. If, however, you're obese, your risk is less. Now, this is quite interesting, and people wonder why. It has to do, and I will be talking about that a little bit later, about the fact that, remember, it's important that we understand what we are comparing with what. Here, your group that has never had will also be the lean group or the obese group. And there is a higher rate of breast cancer in obese women.